So that's a very good question, but it's posed in a way that gives value to the biomarkers. You mentioned a panel with, let's say, cholesterol, glucose, hypertension, blood pressure measurement is inexpensive and can give you so much information. But in my answer to your previous questions, what I said is that the biomarkers only amount to a certain level of information, that it doesn't. If I only use biomarkers for you, I will never be able to say, oh my God, I think you are very close to having an event. You can't do it that way. So I think you're right that the biomarker panels are mandatory. So doctors need to do it in the right patients, in the right way, with the right frequency, so that we have that platform. It's almost like saying, you come to my clinic and I don't ask you about your family history. Is that important for me to know if your father had a heart attack at 52 and if your older brother had a quadruple bypass? It's incredibly important. It amounts to my system for risk assessment. The same thing is for cholesterol, blood pressure, glucose, uric acid. I need to know all these things because they all go together into our risk prediction algorithm. But even with the best risk prediction algorithm, you don't know when it's going to happen. And so you need to have a way to investigate, pick a tree like the carotid arteries or the coronary arteries. We have methods to make assessments and to say to a patient, you're pretty safe, or I worry about you, or very worried about you. We may even need to do additional investigations about functionality of the heart, like a stress test or something.